In May 2018, 15 students from the University of Alabama at Birmingham School of Public Health traveled across Alabama to Mississippi, Louisiana, and Georgia to study population health and see firsthand how social determinants of health and inequities affect health outcomes. Students traveled over 1,100 miles across the 4 states in just 2 weeks, visiting historically significant sites like the Salmon Test Site in Baxterville, Mississippi, where nuclear weapons were tested as part of a governmental project in the 1960s. Fort Massachusetts, on Ship Island, the site of one of the nation's first quarantine stations. The Lower Ninth Ward in New Orleans, where the effects of Hurricane Katrina can still be seen today, and Tuskegee, Alabama, to learn about the legacy of the Tuskegee syphilis study. Students heard from people who live and work throughout these southern communities, including officials from local, state, tribal, and federal public health agencies, about how public health systems are evolving to solve health issues like poverty, pollution, infectious disease outbreaks, chronic diseases, and the impacts of natural disasters. One student shares how this course shaped her perspective on the interdisciplinary nature of public health and the need for attention to the social determinants of health in achieving health equity.
Hi, I'm Claire Oriema, a student in the dual degree program pursuing my MPH in the School of Public Health and my MBA in the School of Business at the University of Alabama at Birmingham. When I first signed up for the class exploring population health on the road in the Deep South, I had zero clue about just how deeply it would impact me, both on a personal level and a professional level. It was an opportunity for us to go out into the field and to take the theories that we had learned in textbooks and see them in real life and see them actually on the ground and what they look like on all different levels of organizations, from government to nonprofits, to seeing how the people in the community actually feel about different programs and initiatives and risks. And it was really, for me, like seeing something in black and white getting turned to color. Like, it just came to life. It made so much more sense for me and really shaped the foundation of my understanding of public health. At every single stop along the way, I was able to see how the social determinants of health greatly impact health equity, health disparities, and the health of entire populations. Every single stop, these things came clear, even though we would be at very different organizations with in very different fields of study. All of those themes kept coming through, and I could see how interconnected it was. It's hard to narrow down which sites were the most meaningful for me, since I learned so many incredible things, but one of the most impactful sites for me was on our first day. It was in Jackson, Mississippi, and we visited My Brother's Keeper, which is a nonprofit organization fighting against the HIV epidemic in Mississippi. And the people there in that organization were so incredible and had so much hope and excitement that it encouraged me that I can go out and I can fight against really daunting diseases and epidemics, that I can fight for the health of a community that's vulnerable and underrepresented. In public health, I know we can get really burnt out really quickly facing these daunting tasks, coming up against so much opposition. But the way that everyone at My Brother's Keeper treated healthcare like it was caring for their own family members, that inspired me. That was really incredible to see on the road. Another really impactful site for me was visiting the Lower Ninth Ward in New Orleans, Louisiana. The Lower Ninth Ward is a community that is mostly below sea level. Before Hurricane Katrina, it had a really high percentage of Black home ownership. And once the hurricane came through and just devastated people's homes, the recovery efforts in that district are so different from what happened in the rest of the city. We were able to see how communities like the Lakeview district All the houses were rebuilt, everything looked beautiful. People were able to retain the value and get back the things that they had lost. Now that community also happens to be predominantly white and wealthy, whereas the lower Ninth Ward is still largely devastated. Rebuilding efforts have not been able to make as big of an impact as we would hope. The people there did not get as much value for their homes. The generational wealth that they had built up was just destroyed. And as a really clear picture of the health disparities between those two communities, the average life expectancy in Lakeview is around 80 years old, whereas in the lower Ninth Ward, it's around 55 years old. That was so hard to see. That was so hard to see, but necessary. Because as public health professionals, things like that, that's our challenge, that's our job. That's what we want to go out and to try to fix and to try to improve. We want to improve life expectancy for people in these communities, and wow, that's just such a daunting task. So that site really stuck with me to see, just all the things that we are up against as we try to decrease health disparities, as we try to increase health equity. Another stop that was really meaningful was in Tuskegee, Alabama, which is widely known for the horrible, inhumane, unjust syphilis study that targeted African American men. And among the sites that we visited in Tuskegee was the Shiloh Rosenwald School, about a 4 or 5 room schoolhouse that was built up and in operation before Black people were even allowed into public schools. It was the type of schoolroom that I imagine my own Black grandma in Texas probably went to when she was in school in the 20s and 30s. And while we were there at the Shiloh Rosenwald School, we met with Felicia Chandler and her family, and they told us incredible stories about their time growing up and going to school in that very building. They were stories of resilience, stories of faith and courage, stories of happy memories, despite having, of course, no air conditioning and few resources. One of their favorite teachers had a theme that had stuck with them through all the years. It was good, better, best. Never let it rest until your good is better and your better is best. And that theme, that motto, was so evident in their lives. Those people that we were able to meet with were able to go on to do incredible things. And yet that site has so much trauma and sadness attached to it as well, because it was these people's fathers and grandfathers who were recruited for the syphilis study at the nearby church. They would meet there and be taken into the city and had terrible experiments performed on them and had treatment denied from them. And the impact of that has lasted for generations. A lot of people will hear about racial injustice and will think, oh, that was so long ago. Oh, we fixed that in the 60s. The effects of trauma remain for generations to come. The distrust in government, the distrust in medical professionals is well-founded. You really can't blame them for the terrible treatment that they had to endure, the betrayal. And as we come out from that, the positive end is that we, as medical professionals, had to develop some regulations for human research that would be universal, that would ensure that humans were never mistreated in clinical studies again. But the effects have not disappeared. I wish that Tuskegee could be known for the resilience and the courage and the joy that was expressed to us by those former students of the school. I wish that it could be known for the legacy of triumph that they presented instead of simply the mistreatment. That site, I don't think I'll ever forget about it. It had a very strong impact on me. Before I came on this trip, I was completely unaware of the conditions that people face in rural areas of the southeastern United States. I'm a California girl, and even though I was poor, I was raised in poverty for California, it's so very different seeing people in these communities that I felt like I couldn't relate to, that went through so many different experiences. But being there, seeing their struggles, seeing their strengths, seeing how they band together, it really helped me be able to envision myself working in a community like the ones I saw. It helped connect me from my faraway life into the reality of public health in the southeastern United States. One of the biggest takeaways for me from this trip was how interconnected everything is. That as future public health professionals, we're not just talking about working with different levels of organizations and with community versus government. We're talking about we have to work together towards common goals with educators, with policymakers, with social workers, with religious community leaders and lawyers, and all of these different fields are so interconnected and related and are so part of the social determinants of health. And so none of these groups, including us as public health people, can stand on an island on our own and try to achieve the goals and the outcomes that we're seeking by ourselves. We have to collaborate and work together. We're all like one piece of a massive puzzle, and we can all do our part. I can't do the next guy's part, and the next girl can't do my part, but we can each do our own part, bring our strengths and our talents together to form this beautiful picture, to form the goals that we're seeking. And that would be the improved health of the populations and the communities around us, the most vulnerable populations, the people that need us most. The lessons that I learned on the road, I know that I and the rest of the students will carry those lessons with us, not just in the rest of our classes here at UAB, and not just in our personal lives, but as we go out and as we pursue careers in the field of public health. What we learned will follow us. It will stay with us. Those lessons were invaluable. I don't know how else we could have seen in such a short span of time all of the different things that we were able to see, bringing to life the knowledge that we already had as a foundation and making it real. That's incredible as far as career building, as far as giving me a vision for my future. And I'm grateful that I got that chance to see those things and to learn about population health in such a real and impactful way.